Our next session is as short as possible because we only have one major presentation, then we will have two minor presentations. And so it will be introduced by our moderator. So our moderator for that session is our one Emmanuel Kaganzi, the Acting Commissioner, Physical Planning Department, Ministry of Housing and Urban Development from Uganda. So our moderator, kindly come to the podium so that you can lead us into this session. So as he's coming, I'm just holding brief for him, but he should be here in a second or so. So we have, I don't know if men are also called Munange. Okay. So I'm supposed to call him what? There is Sebo and there is something. Oh, so I'm right. Eh? Sebo. Sebo, karibu sana. So karibu, how do you say karibu? Welcome? Oh, Sebo, welcome. I should do like this.
Thank you so much. Indeed, where I come from in culture, as ladies kneel, so it is in order. Ladies and gentlemen, good afternoon. As I've been introduced, I'm Kaganzi Emmanuel, a physical planner by profession, and working with the Ministry of Lands, Housing and Urban Development in Uganda. It's another exciting moment to be here and given an opportunity to moderate this session. I'm reliably informed that the meal was okay, so it will not knock anybody, I guess. If you are knocked, just simply take a walk around. We are going to have our first presenter by Dr. Midheme, Emmanuel, and she will be presenting to us an interesting point. He will be presenting to us an interesting point, topic, because you understand that each of us was hit by this pandemic, COVID-19, in different ways, and not on an individual basis. Even it went ahead on institutional and even national and international. So what happens after that? We as planners are professionals. How do we swing into action into the post-COVID era? So for that matter, I call upon our first presenter. Please take charge. Come forward.
Hello, good afternoon, ladies and gentlemen. Thank you, good afternoon.
Good afternoon.
Well, I want to make this intervention very short because I do appreciate the fact that we also have delegates coming all the way from Uganda. Some of them are here for the first time. And indeed, it would be nice if you gave them a bit of time to also be able to walk around and see what Malindi is beyond what we're doing within this hall. I want to talk briefly about human settlements and pandemics. There were supposed to be 3 presentations, but it will only be 1, so I'll try to be brief, but all the same try to raise questions. Mine will not be unlike the presentations we had in the morning where people are presenting results of completed work. Mine will be a little bit more of musings, trying to ask questions that can provoke all of us as planners so that we can even begin to think of how we can be able to handle pandemics as they come along. Because indeed, wherever we are headed, we are most likely to experience more pandemics going forward. It's going to be a fact of life. We are going to live with them. And it's only important that we get to prepare for them as people charged with the responsibility of producing and regulating the sharing of urban spaces. So without wasting much time, I think she'll be able to project the PowerPoint in a short while. But as she does that, I think it's important to point out that human settlements, when we talk about human settlements, they have several components, but there are three rather critical components of human settlements that it's worth talking about, especially in a convention like this. And the three components of human settlements that I'd want to lay stress on this afternoon are shelter, infrastructure, and of course, services. And by shelter here I mean the superstructures of different shape, size, type, and of course materials that are erected by humans for purposes of security, privacy, and protection from the elements, and of course for his singularity within a given community. And then when we talk about infrastructure, I want to use this term very broadly to refer to the complex networks that are designed by man to help deliver on convey goods, people, energy, and of course information. And then lastly, when we talk about services, we're talking about those components that are required by human communities for the fulfillment of its functions as a social entity. And of course, we can name quite a number of these, including education, including healthcare, including culture, including welfare, and of course, recreation. Now, these three components of human settlements are critical when we talk about pandemics and its impacts or its effects on human settlements. Then, my main intervention here is supposed to look at the impacts of pandemics on these human settlements. And of course, when you talk about pandemics, in general terms, there are a number of terms that epidemiologists use, but they have what they call outbreaks, then they have epidemics, they have pandemics. The distinction here being generally in terms of the gravity of the matter that is involved. An outbreak is when a disease or an illness, breaks out rather rapidly. It could cover a small area, but it could also extend into larger geographic areas. We have epidemics when that outbreak is, happening at a rate that is far higher than what experts usually predict or expect. And then where we have epidemics happening at a stage where they go beyond borders, then we talk about pandemics. Now, if you look at the history of our profession, the history of the profession of town planning, whether you want to call it urban and regional planning, or spatial planning, the profession has been characterized by pandemics throughout history. So that almost all the major developments that characterize the development of our profession, whether it's about, the provision of sanitation facilities, whether it's about, public health in general, whether it's about planning legislation, master planning, and the rest, they were, to some extent, influenced by the occurrence of contagion. Whether we're talking about cholera outbreaks, whether we're talking about the smallpox pandemic, whether we're talking about, what they call the Black Death, the plague, or, of course, indeed, the COVID-19 pandemic that we're currently in the middle of. They've had a major, defining characteristic or a major defining role in deciding or rather dictating or determining how we as urban planners organize our craft, how we plan our cities, and how we manage our affairs as inhabitants of the city. Now, looking at the last pandemic that we just had, the COVID-19 pandemic, We've had a number of impacts that are associated with this particular pandemic. Have been both physical, they've been social, they've been economic, and they've been environmental. So I just want to very quickly look at some of the cross-cutting issues that have been associated with this particular pandemic, and especially in terms of how it affects. Scroll down. Next. Yes. So the first cross-cutting issue that I'd want to look at with respect to this, the impact of this pandemic, of course, the question of physical planning and urban design. How do we plan, how do we design the kind of cities that we live in? And when you look at this, this is an example of a structure from a pipeline area of Nairobi. And you look at the kind of buildings, the kind of structures that we're putting up, and then you consider some of the considerations, some of the dictates, or some of the regulations that were put in place in order to help us cope with the ravages of the pandemic. Social distancing, for example, self-quarantine. How do you begin to talk about self-quarantine in a structure like this, where rooms are pretty tiny, quite a number of people living in these particular rooms, because we live in an environment where any single room that is large enough to take a human being lying down will be used as a bedroom anyway. So how then do you begin to reconcile these practical realities with the challenges that come with the pandemic? How do we design the kind of cities that we have, the urban spaces that we have, our public transportation system, for example? Are they designed to be able to accommodate people in such times of crisis? I was involved in some activity in Kisumu during the height of the pandemic, where the street vendors or the street traders had to be made to reorganize the way they use their particular spaces in order to be able to still accommodate the regulations of social distancing, even as they sold their ware. Do we have the kind of spaces, or our spaces designed in such a flexible manner to be able to accommodate that kind of a scenario if and when it happens? And I'm saying this because, like I said, looking at the current trends, the global trends, pandemics are probably going to be a recurrent feature going forward, a recurrent feature in our urban landscapes going forward. Now, the second question, next slide, please. The second question, or the second cross-cutting issues when talking about pandemics and our human settlements, is that of livelihoods. Well, we are locked down. We can't be able to go out, but we still have to eat somehow. People still have to earn an income. So how do you reconcile the dictates, or rather the regulations imposed in order to be able to contain the scourge, and the fact that people still have to earn a living somehow? Of course, as a result of the pandemic, many people lost their jobs. People are locked down, they couldn't go to work. The most affected were those in the informal sector, those who have to go out, sell their labor every single day in order to be able to earn their bread. Now, what happens if you're locked down for a period of 1 month and you can't be able to go trade? You still have to feed yourself, you still have to feed your children, you still have to pay rent. How do you begin to reconcile these practical realities with the necessities to control the crisis that is out there? Next slide, please. The next question is that of urban food systems. And this is critical, especially in our part of the world. Now, many cities in our part of the world are actually net importers of food. So that a city depends almost entirely on food that is imported from elsewhere. It could be from the region, or sometimes even from outside the country. Now you have a lockdown, and there is restrictions on movement. There are restrictions on cross-border movement, for example. How do you still remain able or capable to sustain or to feed the population resident in these particular cities? Now this, to me, is a major challenge, and one that we must be able to think about as planners going forward. Actually, one of the biggest criticisms that has been leveled against our profession is that we tend to look at almost all the other sectors and somehow forget to plan for food. Well, we know very well that food sits at the center of life and livelihoods within the urban center. So how can we begin to integrate this in our plans going forward? Next slide, please. The other cross-cutting issue that I thought it would be important to talk about is that of housing. And of course, housing, as we know, is not just a roof over one's head. Housing is a package of services. So beyond the roof, the four walls and the roof, you're talking about water, you're talking about public transport, you're talking about security, you're talking about energy, you're talking about sanitation, you're talking about healthcare, and so on and so forth. Now, in a situation where people live in deplorable housing, and especially within the informal settlements, people live in an area where there is no water supply, and then suddenly we have regulations that say that you must wash your hands using running water and soap. How do you reconcile these two? The next question I'd want to talk about briefly, next slide please, is related to that of housing, and this is socio-spatial exclusion. The distinctions or the disparities that we have in our social income classes. And particularly when you talk about the poor, who most of the time inhabit the so-called informal settlements. So people living in these particular areas, these are the same people you want to be able to stay home, not move out. You want them to be able to wash their hands using running water and soap. You want them to be able to, basically self-quarantine when one member of the family has been diagnosed with that particular scourge. Is it possible in this particular context? The next thing is something to do with transportation and mobility, especially within our urban areas. We had regulations, for example, that began to control the number of passengers in a minibus, in a matatu. So, for example, we were told that matatus could only carry, I think it was about half the capacity. How do you, control this particular situation? Because people still have to move somehow. Even when we have lockdowns in cities such as Nairobi, those within Nairobi still have to move around to look for food, to look for something to eat, to look for medication, and of course, indeed, to take themselves to hospital, for checkup and so on and so forth. So the question of transportation then becomes important. How do we still manage to move people? Are our transportation systems designed in such a way that we can easily adapt the capacities to accord with the regulations that are put in place when we have such pandemics? And then the question of gender. Next slide, please. And age. Next slide. Okay. Now, these pandemics too have a gender dimension to them. And usually we say that something is gendered when it affects a particular gender disproportionately compared to the other gender. So if women, for example, are affected disproportionately compared to men when it comes to a particular issue, then we say that issue is gendered. Now, there were talks, especially when daily figures about new infection rates were being given out by the officials of the Ministry of Health, and there were questions as to whether it is men or women, who are getting more affected compared to the other. Of course, the debate is still out there as to whether there were any preferences, or rather whether there were any particular, particular skewness in terms of the genders affected, but actually in terms of the impact of the scourge. In certain locations, in certain areas, some genders were more affected than others, especially when we talk about women living within informal settlements, women raising children within the informal settlements. Then the impact or the burden of the disease of the scourge was a lot greater on them compared to the men. And of course, there is a question of age, for example. What particular age groups were more vulnerable to the disease or to the illness compared to the others? Of course, when the immunization process was rolled out, they said we wanted to begin with the senior citizens, those who were 60 years plus. And then after that, they said they wanted now to consider people depending on their, vulnerabilities, the so-called, frontline workers. And then we forgot about the children somehow. I think even up to now, we haven't still rolled out the program to cover the children. But the question then it begs, when we send out our children, to school, to playgrounds and every other place, and then they come back home and interact with their elderly parents or elderly grandchildren, then are there certain risks that we are trying to, that we're really covering at the end of the day when we say that certain people are more vulnerable to the virus as compared to the others? Again, questions that we must be able to ask ourselves as planners who are charged with the responsibility of producing and regulating the sharing of spaces within our cities and urban areas. The next one, of course, tourism affected not just local tourism, that is you and me being able to go out and tour the countryside and be able to enjoy those particular sights and sounds. But of course, tourism also is a major source of livelihood for very, very many people in this part of the world. So with the restrictions in movements, you had a number of people suddenly losing their jobs, losing their livelihoods because hotels were closed. The tour vans, the tour companies were simply shut down, and so on and so forth. So again, there were serious implications. And I think brought out very, very clearly by the COVID pandemic. Ordinarily, we want to think of our societies as hierarchical. So there are people who are probably more important than others. But then COVID somewhat overturned that particular notion. So when all the engineers and the professors were home, hiding from the virus, it is the watchmen, the mamambogas, the boda riders, people who ordinarily we consider to be at the lower the lower cadres of, the lower pecking order, so to speak, or the people out there doing the actual frontline work in terms of making sure that our communities and our societies are actually moving on. So there are questions as to whether some of the assumptions that we've held in terms, let's say, of the importance of the various socioeconomic classes would still hold in the event of a pandemic such as the one that we just had. One thing with pandemics is that usually they are no respecters of socioeconomic boundaries. They're no respecters of geographic boundaries. So they'll always penetrate anyway. Now, having looked at these, some of these broad areas, I thought it's important probably to begin to look at some what I call thematic areas that could aid the process of recovery as we try to rebuild, try to repair some of the damages caused by the pandemic. And of course, given the assumption that this will not be the last pandemic, we are probably likely to encounter more, it is important to begin to think thematically about how we can prepare a lot better so that we are more placed in a better position to be able to handle, to respond to upcoming pandemics, and to be able to do a better job than what we did the last time we had a scourge. And I'd like to talk about 4 main thematic areas. So the first one is, next slide please. Yes. Rethinking the form and function of the urban areas and cities that we have. Remember I said that one of the first areas that I talked about earlier on in terms of areas, cross-cutting areas where the impacts of the scourge was felt out, is that area of spatial planning and urban design. How we design and build the cities that we inhabit. And here I really do not have answers. Rather, I have questions that I'd want to invite you to help me answer. And with respect to rethinking the form and function of the city, for example, I have 2 main questions that I'd like to ask here. Now, how can we, for example, reconfigure urban morphologies and institutional structures at different scales in order to enhance their resilience to the effects of pandemic like the one we just coming out of, and of course the ones that we still anticipate in the near future. Another question that I'd like you to help me answer is how can we make cities more sustainable and productive in the long run through inclusive planning, design, and of course, governance. Like I said, I don't have answers, but these are questions that I think we can be able to think through together. Do we plan our cities in such a way that we can be able, to adapt whatever spaces that we have to respond to the practical needs if and when they arise? Now, this is an example of, a football stadium in Brazil that was converted into a field hospital in order to be able to take care of patients the surge in numbers that could not be accommodated by the hospitals. At our facilities, I remember when the schools initially were reopened, and the Minister of Education said that we can actually use the fields. We can actually use the fields of our classrooms. When there was a complaint, people were complaining, how come we were not able to build enough classrooms to be able to take care of the children before we release them back to the school? So is it possible for us to design our spaces in such a way that we can be able to adapt them, if and when need be, in order to respond to such circumstances? Next slide, please. Yeah, this is an example of a project I was involved in Kisumu, where street spaces were actually converted into temporary markets, where the mama mbogas could be able to still sell their wares in order to make food available to the inhabitants of the city who were locked in during the scourge. Next slide. Yeah, still same example. So spaces were created where people were still, the mama mbogas were still able to sell their wares without contravening, the social distancing regulations and so on and so forth. Now the other area that I think we can begin to thematically think about is that of addressing systemic poverty and inequality. And I think I showed through the previous slides issues of poverty, those residing within informal settlements where there are lack of services, there is no water, there is no sanitation, there is no power, no transportation, and we still have to be able to take care of them. And the questions here I'm asking is, how can we design targeted interventions that mitigate the disproportionate impacts of pandemics on poor and vulnerable groups through emergency assistance and service provision? When you lock somebody up in Kibera for 1 month and they can't go out and work, they still have to feed themselves, they still have to feed them, the children, there is a problem. Unless we are able to provide some subsidies, provide some food rations to these fellows, we are simply tying them up in prisons. The second question is, how can we also take deliberate steps to address the underlying causes of their social spatial exclusion? In other words, can we be able to find more lasting solutions to the problem of informal settlements and inadequate housing so that we are able to provide at least some modicum of services when it comes to life within these settlements? Next slide, please. The next thematic area is that of rebuilding a new, what they call the new normal urban economy. We're existing from what we were used to, and we're getting into a new normal. And like I said, pandemics are probably going to be a more recurrent feature going forward. So the question I'm asking here is, how can we develop a suite of tailored economic support and relief packages to help smaller businesses, for example, informal workers, and at-risk sectors to survive crises such as the pandemic that we just came out of? The other question is, can that be done with an emphasis on building back better by promoting the transition to greener, more equitable, and of course, more equitable urban economies going forward? Next slide. The next slide, the next thematic area that I thought of has something to do with clarifying urban legislation and governance structures. And here again I have certain questions. And question number one is, can we recognize the need for more integrated, cooperative, multi-level governance logics between national, regional, and of course municipal governments, so that regulations, rules, and protocols can be able to cascade both down and up the hierarchy without necessarily compromising the competencies of each level of urban governance? The second question is, can this be done with an emphasis on developing more flexible and innovative institutional and financial frameworks for cities in order to help them respond effectively or more effectively to this and future pandemics? We know that cities suffered a lot. When you have a lockdown, the amount of revenue generated locally goes down because the amount of sales collected, the amount of taxes collected on a daily basis goes down. In some cases, even the national transfers, the money that comes from the national government to the local authorities or to the county governments, was cut down because that money was diverted somewhere in order to be able to respond more appropriately to other dimensions of the scourge. So is it possible, therefore, to be able to design better structures that can be able to facilitate, flow of money and resources to the lower level where it is needed most, even in such times of crisis? And then very quickly, by way of concluding, yes, I think COVID-19 has shown us a number of opportunities, in as much as it presented challenges, but there were a number of opportunities as well that came with it that I think we as planners can be able to seize upon in order to be able to think better. The kind of plans that we put up, the kind of cities that we design, the kind of governance structures that we put in place in order for us to be able to build better cities and urban areas going forward. Next slide, please. Yes, I think I really talked much about this. Next slide. Yes, I think I want to conclude by, posing some practical questions, and especially some based on, some of the issues, some of the things that I saw, especially working with people from informal settlements. At the height of the pandemic, I was involved in some project that, was aimed at, responding to some of the vagaries, some of the challenges that residents of informal settlements were facing at this particular time. And out of that particular exercise, out of that experience, there's certain practical questions that I think we can be able to ask ourselves collectively as planners so that we are hopefully better prepared for pandemics if and when they come again. One of the questions is, how do we design our market spaces, for example, as multi-purpose spaces so that they are not rendered obsolete during times of pandemics? Do we have the spaces to be able to do that kind of design? Do we have the skills? And do we have the political will to develop such kind of designs so that we are able to build what they call pandemic-proof, to build and design what they call pandemic-proof cities? How do we design appropriate homes, for example, to facilitate home-based care and allow us to work remotely from for any length of time, like was the case during the pandemic? Suddenly everybody was told to work from home. When you live in a room that is so tiny and you're so many people in that particular room, how do you self-quarantine? Is it possible? Does it even make sense to begin talking about self-quarantine when you live in a room and you're about 4 or 5 of you in that particular room? Now, in the wake of joblessness, how do we create jobs? By leveraging on IT and, of course, other emerging technologies. Of course, this could be a short-term measure, but it's also possible there, I think, to be able to leverage on the new technologies that we have. IT is just one of them. For us to be able to extend the boundaries of job and job creation, especially so that we can be able to cushion some of, the income earners in the event of an epidemic or a pandemic. And the last question I'd like to pose is, how do we revalorize the contributions of the taken for granted cadres? I already talked about this. When you talk about the mama bogas, when you talk about the watchmen, when you talk about the border guys, that the society has, traditionally sort of forgotten when we talk about, social policies, for example. And like we saw during the pandemic, this became actually the frontline workers, the matatu touts, the drivers. They were the people who were out there basically doing the nation building work as most of us were taking cover from home. Like I said, my intervention was not to offer solutions, to offer answers, but rather to raise questions that I thought we collectively as planners and as people charged with the responsibility of designing urban spaces can begin to think about, even as we anticipate, other pandemics coming in the future. Thank you.